Good morning, everyone. Thank you for joining us for this webinar, Our Planet, Our People, on the health impacts of climate change. This webinar is in partnership with the Institute of Psychiatry, Psychology and Neuroscience at King's College London. I'm Hannah Bretherton, the Lao China Institute's Impact and Engagement Manager, and I'm delighted to welcome you to this session on day 3 of our inaugural China Week. Last month, the world's leading medical journals banded together in a joint editorial to warn that there will be catastrophic harm to human health if drastic and urgent action isn't taken to address the impacts of climate change. Ahead of the UN COP26, which begins in Glasgow next week, this editorial was a somber reminder that climate change is not just impacting the environment and the economy, but that it has very tangible impacts on the health and well-being of people all across the globe. Today, we are honoured to be joined by leading health researchers across the globe from China, Australia, and the UK, who have expertise across a range of health effects that are linked to climate change, including both physical and mental health impacts. A little note on the format of today's session. Each speaker is going to begin with a short presentation on their topic area of expertise, and then we will join together for a whole panel discussion. There will be time for audience Q&A as well, so please have your questions ready to pop in the Q&A box at the bottom of the screen. I'm now pleased to introduce our first speaker, Professor Qi Zhang, Professor in Economics, Policy, Energy and the Environment at the Beijing Institute of Technology. Welcome, Qi. Thank you.
Hello. Yes. Hi. Hello, everyone. It is my pleasure to be invited to the China Week event. And then today I would like to give a presentation about the 2020 China report of the Landsat countdown on health and climate change. So please, next. So first of all, I would like to give a brief introduction about the background on this report. So since 2015, Landsat Commission on Health and Climate Change has proposed the initiative with the aim of producing an annual suite of indicators tracking the relationship between health and climate change. The Landsat Countdown published its first report in 2016, proposing its indicators, domains, and calling for further inputs. And then each year since, the Landsat Countdown has reported its indicators and improve the method with the database and the other indicators. And then till 2020, Landsat has published the 5th global report, and Landsat Countdown Asia team has published the first China report. Next, please. So this photo was shot on the release conference last December, and this year we will publish the 2021 China report of the Landsat Countdown on health and climate change on November 8th. Next, please. And as the home to 1/5 of the world's population and the largest carbon dioxide emitter in the world, China's climate change action will significantly improve living environment and physical and mental health of the public. Also, with the COVID-19 still raging around the world, the public and populations has never been so concerned about health. Domestically, 2020 is the beginning, the former one, please. It's the beginning of the a couple of different commitments, such as the 2030 Sustainable Development Goals and the Health China Action Plan and the carbon emission peak. and we still have 40 years away from 2060 carbon neutral goal. It is urgent to implement the principle of integrating health into all policies and formulate a health-oriented climate action plan. Next, please. So the collaboration draws on expertise from 19 leading academic and institutions worldwide and brings over 77 experts to produce 34 different indicators, including climate, geography, transport and energy experts, and economists and social and political scientists, and also the health professionals. It was the first endeavor to track China's progress across all the dimensions of health and climate change. And also the China report of Landsat countdown will update every year with provincial level details. And each year we will update with new important gaps in our indicators. Next, please. So there are 5 working groups of Landsat countdown report also. So this is the diagram to show about those groups. In the central, we have the climate change impact, exposure, and the vulnerability as the group 1. And below we have the response to the health impact of climate change in the form of health adaptation planning and assessment as the group 2. And also as the group 3, we have the mitigation action and the health co-benefits indicators. And the surrounding all of this, we have the economics and finance as the grouping 4. And then the public and the political engagement as the working group 5. Next, please. So today I would like to share some key findings of the China report. There are 2 of them. First is every province is affected, each with its unique health threat, and targeted response strategies should be made accordingly. Second is that impressive improvement has been made, but the gap still remains large. And under the on this page, we have 3 graphs. Next, please. Yes, and so the first and second one I will explain in the later slides. The third one is that among all the mainstream media posts, we could see that only 1 blue dot. That means that only very few mainstream media posts in 2020 has focusing on the climate change and health, these keywords. And so we still need to raise a lot of public awareness on this topic. And next, please. Different regions have unique health threats requiring a targeted response. From this China's map, we could see that the 15 province has experienced at least a 10% raise over the past 2 decades in 4 or more of 6 health impact indicator reported. So that means that the darker the color is, more indicator the risk they suffered from in each province. And for the chart, that means that we have the different which each indicator weighted equally. The size of the slice of is proportional to the size of the growth rate of each indicator. For example, that in Gansu province, the most risk indicator is the wildfire exposure. So yes, thank you. Next page. Next, thank you. And then I would like to give 2 examples about the indicators. For, excuse me, the former one, the former page. Yes, for the elder people, in 2019, every senior citizen in China experienced 16 more heat days than the past. The heat waves increased the risk of death by 10%. For example, for Yunnan province, every elder people there experienced more 39 days in 2020 compared with the year 20 years ago. Yeah, next page, please. For the middle and young age people, the heat wave reduced their labor efficiency and made the economic development affected. So the economic cost of the heat-related labor capacity loss reached 126 billion US dollars in 2017, taking 1.14% of China's total GDP. So next page. And so for the all age populations in China, the heat wave related deaths are rising fast. In 2019, there were 26,800 heat wave related deaths in China, an average increase of 1,000 every 1.2 years over the past decades. Next, please. The second key message is that the gap in China's response to the health effect of climate change is still large. Next, please. Although we have already fulfilled the commitment about cutting down the carbon dioxide emission per unit of GDP by 48% till 2020, and also the investment on low carbon investment are now 9 times higher than those of investment on coal and those fossil fuels. But still, the coal still holds over 59% share of the total primary energy supply in China, and have the subsidies around 41 billion US dollars, taking third place worldwide. And also for the ambient PM 2.5 pollution in urban China has decreased nearly 28% in the last 5 years. But it's still leading to a reduction about 90,000 premature deaths because of those air pollution control. But still 42% of the total population is exposed to the annual average PM 2.5 concentration of more than 35 microgram of cubic millimeter. Next, please. So there are 2 overview about the impact and the responsible 2 parts. So that means the darker colors indicates a more concerned effect and a more ambitious response. For example, we have more and more elder people suffering the heat wave days. And then we have like more heat wave related loss. But recently, we have made a improvement on the coal phase out, and also we have generated more low carbon electricity. So next, please. So we proposed 5 key recommendations in our report. There are enhance the interdepartment cooperation, strengthen health emergency preparedness, support research and risk awareness, increase climate change mitigation, ensure the country's recovery from the COVID-19 pandemic, protects health, but now and in the future. And next one, thank you. Okay, thank you for your listening. And if you would like to know more about the Landsat countdown, especially on China's report, you could follow up by this QR read, and also just looking forward to the new publishment on the 2021 report. Thank you.
Thank you so much, Chi. That was fantastic. I'd now like to welcome Professor Haidong Khan, who is from Fudan University and also an affiliate at the World Economic Forum. Welcome, Haidong.
Thanks. My name is Haidong Khan. I am from Fudan University in Shanghai, China. I'm very happy to join the China Week event. Today, I'm going to talk about the disease burden of weather or climate in China. Next, please. So as we all know, climate change is the biggest threat for human society in the coming century. Next, please. How about the disease burden of climate or weather globally and in China? Here is the latest estimate from the study of global burden of disease, GBD study. In 2 years ago, the GBD study for the first time introduced temperature as a risk factor for global burden of disease. Next, please. So globally, non-optimal temperature, which means low or high temperature, is the number 11 risk factor for global mortality, accounting for about 4% of mortality in the world. How about the disease burden of temperature in China? Next, please. In China, in this GBD study, temperature is the number 8 risk factor, accounting for about 6% of total deaths. It looks like in China, the disease burden of temperature is much higher compared with the other countries in the world. Next, please. How about the other study? This study was published 6 years ago, and this study is a global, I think it's a 15-country study published on Landsat 6 years ago. And this study, the estimate for lower or high temperature was much higher. I mean, compared with the GBD study, the estimate was 11% of total deaths is attributed to low or high temperature. Next, please. Is the estimate higher or lower? Because all the previous studies are based on very local, very limited data in China. So 3 years ago, we conducted a study based on a very large epidemiology database. In this study covered more than 272 Chinese cities, covering almost all the big or middle Chinese cities, accounting for about 26% of the total population in our country. Next, please. So here is our estimate for the relationship between temperature and mortality. And we can see that from the upside, we can see that for both total mortality and cause-specific mortality, the relationship are pretty consistent. I mean, the relationship between temperature and mortality are U-shaped. And the minimal mortality risk was almost 22 Celsius degree. And in the lower part, you can see that for both North China and South China, I mean, the lowest mortality risk temperature was also consistent to 22 Celsius degree. Next, please. Next, please. So how about the disease burden estimate? So this is the estimate for total mortality and cause-specific mortality. We can see that non-optimal temperature, low or high temperature, accounting for about 14% of total mortality. For cardiovascular mortality, the estimate was much higher, accounting for about like 70%. For respiratory disease mortality, the estimate was lower, accounting for about 10%. Next, please. So here is the area-specific estimate. For North China, the climate zone is temperate monsoon, and for South China is subtropic monsoon. And we can see that for North China, the overall estimate was 17% of total mortality. And for South China, the estimate was 13%. Next, please. We also estimated the vulnerable population. From this figure, we can see that the old people, the female, and the people with lower socioeconomic status were more vulnerable to temperature change. I mean, compared with the young people, the male people, and the people with higher SES status. Next, please. As China promised, China will reach carbon peak in 2030 and will reach carbon neutrality in 2060. How about the disease burden in the future under various climate scenarios? Next, please. So this is the temperature estimate in China on the different climate change scenario for SSP 126 and SSP 245. Next, please. This is the area specific estimate for temperature under various scenarios. And basically, we can see very similar temperature change pattern across South China, North China, and Central China. Next, please. So this is the disease burden estimate in the under various climate change scenarios. We can see that this is the estimate for just two scenarios, SSP 126 and SSP 245. And we can see that for both these two scenarios, the disease burden of low or high temperature will remain. And in both scenarios, the disease burden of temperature will remain very high, pretty high in China, accounting for about more than 10%, less than 20% in China. Next, please. Finally, I would like to say, don't forget air pollution. China is one of the countries with the highest air pollution level in the world, and air pollution alone is the number 4 risk factor for human mortality in China. So we as a human being are exposed not only to temperature, but also to air pollution. So we need to consider air pollution and the temperature health effect together in the future. So here, my group developed a new index, air health index, including both the health effects of air pollution and both the health effects of temperature. Here is our website, and you can see we developed an online system to show the health index, air health index in different Chinese cities. Next, please. So here is the key message. The first thing is, I think the local evidence shows lower or high temperature is a very important death risk factor in China, accounting for about 15% of total mortality in whole China, 17% in North China, and 13% in South China. This estimate were much higher than the global burden of disease estimate, and the substantial mortality burden may remain under various climate scenarios, and the vulnerable subgroups including female, the older people, and people with lower socioeconomic status. And the higher urbanization rate cities might be more vulnerable to temperature risk change in China. Next, please. That's all. Thank you very much. Thank you.
Thank you so much, Haidong. I'm delighted to now welcome Professor Tong Zhu, Dean of the College of Environmental Sciences and Engineering at Peking University. Welcome, Tong.
Hi, so thank you very much. And as Haidong mentioned, the importance of air pollution, and even though we're talking about climate change, we should not forget that air pollution is one of the major environmental factors causing mortalities. But in the past, when we estimate the global burden of disease, we mainly use the cardiovascular disease, and we pay less attention to the effect on our reproduction, which could be very crucial for the future. Next slide, please. Well, as you can see, that if we took up the number of deaths, the reproduction associates is much smaller compared to other disease. But if we look at the year of life lost, it actually could be as high as 14% of all the year lost associated with PM 2.5. Next slide, please. Next slide. Thank you. There's growing evidence that particular matter in the air actually associates with our reproduction. And this is one of the Barcelona study. It found coarse particles was significantly negatively correlate with fertility rates. Next slide, please. Next slide, please. Our study, in recent years, we have found in the United States and China that with the increasing of PM 2.5, we see that the fertility rate reduction actually going down. This is a very clearly showing up in these two figures in the middle. In the upper middle is the United States, and in the lower is in China. And we see clearly that the increase of PM 2.5 and fertility rate is reducing. Next slide, please. If we looking at, well, this is a little bit complicated how we did the study, the flow chart, how we combined exposure to the fertility rates and build up its association. The major message from this slide showing that each increase of 5 microgram per cubic meter, we see 0.7% of fertility rate reduction. And if we look at Singapore, if many countries have 50 microgram per meter PM2.5, and the number could be very huge in a sense, in the reduce of fertility rate. Next slide, please. Yeah, besides the fertility rate, there's also very important fatal outcome from the pregnancy loss, which we here see the stillbirth and the spontaneous abortion. And from these slides in the table and the figure showing that with the increasing of the PM2.5 exposure, and we see there is a higher risk of the stillbirth, which is in the table showing that. And also there's a spontaneous abortion, and in the parts of this slide. Slide, please. Well, in Africa, there is the continent with very high rate of pregnancy loss. And when we combine the satellites and the global model, we build up the exposure of PM2.5. Then we use the phase control and safe match design for the phase control to look at the pregnancy loss. We see clearly that the increase of PM2.5 exposure the miscarriage, stillbirth increasing, and there's another evidence over the continent of Africa. Next slide, please. In the South Asia, there's a region also with the most pregnancy loss. We also see that as a robust or significant statistical association of PM2.5 with the pregnancy loss in South Asia. Next slide, please. There's also evidence regarding the non-fatal outcome. We use the Beijing preterm birth study as example. And this slide showing that with the increase of PM2.5, with the odds ratio of the preterm births were increasing. Next slide, please. So, in summary, we see a chain of the evidence that exposure to PM2.5 could cause our reproduction from the early start in early stage of lower sperm quality and to the maternal and embryo defects, to the pregnancy loss, and finally to the decline of fertility rate. So we have built up a chain of evidence for this one. Next slide, please. In conclusion, we found that in utero exposure and also in the large scale exposure, the evidence that reduce the human fertility or reproduction are strong associated with PM 2.5, which is happening globally. And we want to emphasize the effect on human reproduction actually bring a heavy disease burden to the population globally. Next slide, please. All right, I thank you for your attention.
Thank you, Tong. That was fantastic, and looking forward to delving into it more during the discussion. I'd now like to welcome Yanis Bikolis, who is our senior lecturer at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Welcome, Dr. Bikolis. Thank you.
Thank you, Hannah. Good morning, everyone. Today, I'm going to tell you a story, and particularly an unhealthy love story between air pollution and mental health. Next slide, please. I will start my presentation by inviting you to look at the picture on your screens. This is not a picture taken during the COVID-19 pandemic, during the last 18 months. This is a picture that is taken during the Great Smog of London in 1952, which is one of the most adverse pollution events that resulted back then in 12,000 deaths, according to recent estimates, and acted as a catalyst for improving public awareness in relation to air quality and health, as well as it created new policies and regulations within the UK and abroad. Next slide, please. However, even after 60 years since the Great Smog of London, we are still experiencing a slow motion pandemic. Despite considerable efforts to improve air qualities in cities. Air pollution is not only harmful for our planet's climate, but it's a leading environmental cause globally for mortality. And these global mortality estimates are based mainly on the impacts of air pollution on our hearts and our lungs. However, recent evidence show that dirty air and polluted air is not great for our brains either. Next slide, please. And there's no health without mental health. Alongside air pollution, mental health poses one of the biggest challenges in the 21st century. According to estimates in 2017, 1 in 10 people were identified as having common mental disorder globally. And most importantly, people with severe mental illness have 15 to 20 years reduced life expectancy. So they live 15 to 20 years on average less than the general population. And there are a lot of risk factors that we can account for that, such as poor income households, or childhood trauma, or social isolation of the population. However, the toxic impact of air pollution should be equally worth our attention. Next slide, please. And there is growing evidence that air pollution is being associated with mental health over the life course. So recent studies have shown association of air pollution with incidence of IQ deficits in teenagers, with the incidence of neurodevelopmental disorders such as autism spectrum disorders and ADHD and attention deficit hyperactivity disorder, with the incidence of depression, anxiety, psychosis, and schizophrenia, as well as air pollution has been associated with the incidence of neurodegenerative disorders such as dementia and Parkinson's disease. Next slide, please. Also, a recent study from our group recently showed that we found that air pollution was associated with increased severity of mental disorders for people with pre-existing mental health conditions after illness onset. And we observed this association across a wide spectrum of clinical need. So we observed that air pollution could be associated with people who were having a pre-existing psychosis disorder, And that means that they were more likely to use the community mental health services more, or the inpatient care units, and also with people that were experiencing a mood disorder as well. Next slide, please. And if all this association that we're observing in the studies that we conducted within our group, but also across other studies globally, are causal, reducing air pollution could be an important way of improving populations' mental health, and as well reducing the associated healthcare costs related to which are due to air pollution. This week is an important week for us here in London, as there is the introduction of the expansion of the ultra low emission zones. And the ultra low emission zone is a way of tackling air pollution by providing more stringent measures and allowing vehicles with particular exhaust emissions to enter the Greater London city centre. And the ULEZ is one of the ways that we can improve and protect the quality of our neighborhoods, and has been proven since its introduction of the ultra low emission zones in 2019 that is an effective measure of reducing air pollution. And we need these bold measures to move forward, because air pollution, such as climate change and structural inequalities, is not a problem that could be primarily resolved by science. This is a problem that is deeply embedded within our individual and societal decisions and our power relations of our political systems. So we all need to ask the questions if we are willing to revert these processes in order to protect the quality of our neighborhoods and bring this unhealthy love story to an end. Thank you very much.
Thank you, Yanis. That was super interesting and very topical for those of us based in London with that latest policy on the ULEZ. So thank you. I'll now welcome Associate Professor Ying Zhang, who is joining us from Australia from the School of Public Health at the University of Sydney. Welcome, Ying.
Thank you, and hello, everyone. Can you hear me?
Yeah, yes, good. Perfect.
I'm speaking from the Camarago land in Sydney, Australia, and I'd like to acknowledge my respect to the elders past, present, and emerging. I am an epidemiologist working on climate change and health research and education. It's a great pleasure to speak about our case study on climate change and ethnic minority groups in China. In collaboration with colleagues at the South Central University for Nationalities, we conducted surveys and interviews at remote ethnic minority communities to better understand their perceptions and how we could build resilience to changing climate and environment for these communities. And next, please. And these pictures would give you some ideas about the living environment and conditions in one of our study areas, the villages in the mountain regions of Hubei province, China. The picture in the top right corner is the container that was used to hold their household water. So the picture in the top middle is a typical traditional house that you can see, and you can see the indoor condition in the bottom corner picture. Lots of these houses are actually in the low-lying areas, and as you can tell, it's very vulnerable, highly vulnerable to floods, which unfortunately frequently hit the region. The region is also becoming warmer with much hotter summers, even in the mountain areas. The other two pictures here show some ways of water irrigation for their crops. So in Hubei province, the population living in poor and remote areas is dominated by some ethnic minority groups. So next, please. And their perceptions, understanding, and responses to changing environment and climate change could be very different and unique to other groups. The farmer's life heavily relies on nature And they have already perceived the increase in temperature with less snow in the mountain. And Haidong already mentioned the relationship between increase in temperature and mortality in China. But however, there is a lack of understanding of the big picture of climate change. The big picture that underlines local environmental changes and its impacts on their lives. There were already increases in seeking medical services for both physical and mental health issues, but we have found that it is very hard to engage local people in the conversation on climate change and adaptive responses. For example, there were very few behavior changes during hot weather because they usually had very cool summers in the mountain regions. Next, please. So this is my final slides that just reiterated some key messages as climate change exacerbates health inequity, not only in China, but globally. Ethnic minority groups that has unique connections with nature could be at higher risks of climate change due to existing social inequities in the society, but there are usually less opportunities for them to be engaged in decision makings and policy making. There are huge gaps in public health research focusing on these groups. We need a more inclusive approach in research and policy making that can meet the real needs of these populations and therefore better understand how we could integrate their traditional way of living and knowledge into programs and actions that could protect their health in the context of unprecedented climate change. This is just a very brief summary of what we have been doing in China over the last couple of years, and just a nutshell from me in 5 minutes. We also did field work in remote indigenous communities in Australia. The Australian countdown report that I lead was also published the last week, in which we added a new indicator on climate change and indigenous health to fill the gaps in the research. But today we are obviously focusing on perspectives from China, and I'm happy to take any questions now, or feel free to get in touch for further discussions. Thank you very much.
Thank you, Ying. I'm looking forward to delving into that more during the discussion. Really, really interesting stuff. I'd now like to welcome Dr. Shuo Zhang, who is a mental health clinician and an honorary research associate at the Institute of Psychiatry, Psychology and Neuroscience at KCL. Thank you, Shuo.
Great, thank you so much for inviting me to the panel. Next slide, please. So we've heard from our speakers about the direct impacts of climate change on mortality, on prematurity in women, and also on the air pollution and mental health things. And I guess I should say that I wear two hats, and one of my hats is as a physical health doctor initially, and also now training in mental health. But as a clinician, I want to do what's best for my patients, and I've been aware of the climate change impacts on health since 2008, and in particular, there has been quite a lack of evidence around mental health impacts. But I think the tide is about to change. Next slide, please. And especially in terms of the Royal College of Psychiatrists, who have taken an increasing leadership role in thinking about the emerging evidence around climate change and mental health impacts, but also in establishing some policy in terms of making the college more green and trying to make mental health services more green. And I was really honoured to have been invited to contribute to this special issue of the BJ Psych Bulletin with a paper thinking about the inequalities in climate change impacts, and also and how it might exacerbate pre-existing inequalities on the mental health of global populations. And I wrote this paper with other colleagues from the Institute and also Dr. Isabel Braithwaite, who led a review of air pollution. Next slide, please. So just apologies for the notifications for my emails. I should have probably switched that off beforehand. But so thinking about the overall picture, so we know that populations have increased exposures to some of the causes of climate change, such as air pollution. In particular, in England and Holland, there's been studies that have shown that the most deprived and ethnically diverse neighbourhoods are exposed to the highest concentration of air pollution. And also our communities, as we've heard, are increasingly vulnerable to the impacts of both climate change and other global insults, such as COVID. And that might be due to patterns of discrimination, exclusion, poverty, land dispossession, and malnutrition, which they are already exposed to. Next slide, please. There's also, I guess, indirect or more systemic and structural reasons for why there might be these unequal impacts. And globally, we have to say that these impacts of weather events and of climate change have to be understood in the context of a broader social political processes, of which structural racism is a part. And we have evidence from previous natural disasters in the West, in terms of kind of Hurricane Katrina, where Black and ethnic minority communities had increased rates of PTSD and stresses and following the event. And also we have to think about people with severe mental illness and whether they are at greater risk due to the direct consequences of their illnesses or medications, and also due to the contributors in the kind of etiology of mental illness, such as social exclusion, stigma, and the unequal distribution of resources that they experience. Next slide, please. And thinking about an urban setting where most people live, we know that people who live in cities have increased rates of psychosis, depression, and other mental health disorders. We looked at the evidence that obviously they are exposed more to air pollution, but they also have lack of access to interventions that are health promoting, such as green spaces. And in particular, in a field where there's a lack of evidence, there's a particular lack of evidence from lower middle income countries. Next slide, please. And we wanted to kind of highlight that actually some of this is because it's a problem on multiple levels, and it requires us to address a complex problem. And the research methods that we have so far have tended to be quantitative and be focused on more proximate causes, and that actually maybe a more systems-based approach is really needed to understand the overlapping and intersectional contributors to inequalities in mental health, and also in order to kind of address these risks. Next slide, please. So we wanted to think about action and think about how we could work together with different specialties, but also with researchers and policymakers. And we used a model from our Australasian colleagues in terms of understanding and addressing climate change. And it calls for collaboration. So working with disadvantaged communities so that their voices and priorities are better heard, so that we can help them influence policy decisions, and to build on the pre-existing multidisciplinary work across different specialties with patients and the public to drive change on key issues. And as researchers and as clinicians, and we have a role to advocate for our patients and communities' health and well-being, and for actions that might strengthen local community resilience and tackle global injustice, and to advocate for funding for more research, but also to roll out evidence-based interventions. Next slide, please. And in terms of research, I think we need to kind of join up our thinking in terms of looking at the root causes of both inequalities and climate vulnerabilities and how to build up our resistance. But we also need to kind of build up an evidence base for action and systems-based approaches that might use different sources of evidence to look at to understand the whole picture. And we also need to kind of mitigate. So that would be to look at our health systems in terms of thinking about prevention of mental health disorders earlier on in the life course, strengthening our mental health systems and making sure that they are linked in with local health services, and improving the equity in terms of access to care. And we should act at whichever level we have influence in. Next slide, please. So I guess just thinking about the, what's going to happen in the next few weeks in the UK, in Glasgow, in terms of COP, something that really keeps me going is this idea of like, what if we make all of these beneficial changes to people's health for nothing? We can improve our health systems and we can improve our cities, regardless of whether climate change is happening or not. Thank you very much.
Thank you so much, Shaw. I'd like to welcome all the panelists onto the screen for our discussion component. We don't have a lot of time, so we'll try and whip through, and we'll get to the audience Q&A as well, because there have been a few questions coming through. But Shaw, I think that was a fantastic image, that cartoon to end on, because it's very topical ahead of COP26, and as you say, that sort of blackboard of options of the positive changes that might come about from climate action is really important to focus on when there's a lot of complex information out there and potentially misunderstanding around why this is so crucial and so urgent. So that leads me to the first question that I wanted to ask you, as practitioners or researchers and being involved in the healthcare community. These issues are not new for the people on the screen, but they might be new for our audience or for people in the broader community, as it's not necessarily the health impacts of climate change are not necessarily something that, make headlines every day in the broader dialogue on climate. I wanted to ask with the general questions of why is that, and is it something that we're finally seeing that's starting to shift in terms of that awareness? Yanis, can I start with you?
Yes. Sorry, I think there's an issue for that. Yes. So I think yes, that's a very important important question, and it's brilliant that we have more awareness in relation to these issues as well. So I think one of the important topics we need to think is about what would be the interventions moving forward. And, I mean, we know that we can increase public awareness as we can, and I think increasing public awareness and approaching different communities, vulnerable communities, for example, which are impacted from these issues. Either we're talking at a global scale, like for example in more kind of for low middle income countries, or we're speaking about vulnerable communities within the cities that we are living, people with pre-existing inequalities or people with pre-existing conditions. That would be actually important, how we can actually reach this, how we can reach these populations and actually make them more aware around air pollution and climate change and the impact on health and mental health that we observe.
Yeah, absolutely. And that point around, vulnerable communities and existing inequalities, we heard from Shuo and Ying about this. And I think that's a really important to pull out in this discussion. Ying, what have you found works when working with these communities to raise awareness, I guess, in the communities themselves, but also in the governance structures across policy making to support these communities? What sort of tactics can we use there?
Thanks for the question, Hannah. I guess the first step, and also the most challenging step, is to engage them in the conversation on climate change, in the big picture, rather than have this short vision about what is happening now. We have to think what would happen in the future if there's no action can taken to respond to the big picture. And also we need to use their own language to communicate about climate change risks and impacts. It's not only about health, it's also about their work, their employment, their income, economic development for the whole region. So we have to, I think there are frustrations, of course, but we can change that to motivations and continue our work with the remote and most vulnerable populations, as they are the most mostly affected in the community.
Yeah, absolutely. Sure. Just building from that, you spoke about the importance of collaboration between different groups, whether it's communities, clinicians, policymakers. How do you think we bring those groups together?
So I think there's different ways and different forums in which that can happen. And I guess starting initially as a clinician, I know that within the college, we often try and get, we're making links with other organizations, with kind of civic organizations, and also with service users to actively bring people in. But I guess in terms of COP26, it's a great forum in terms of getting different people in the room, and there's been quite a lot of momentum and activism being building around that. I guess what needs to happen is that momentum to be captured, and for those relationships to be maintained, and for that to kind of result in action and in policies and within for change. So I guess we kind of need to think about what governance structures are needed. I guess what support to institutions that have power and resources, maybe like universities, I guess like the Royal College of Psychiatrists, which I'm a member, but there are other Royal Colleges and other organizations of different groups within in different countries. So I guess we could maybe need those organizations to take a little bit more of a leadership role in terms of holding the responsibility in terms of translating enthusiasm into action.
Yeah, definitely, I agree. And you mentioned COP26 there, which I think, as you say, is such an important platform, and leads nicely to a question we've had from the audience for Chi about international cooperation and how other countries are working with China to address the health impacts of climate change. Chi, are you able to shed some light on that, on initiatives that are happening between China and other countries? Chi, I think it might be a little bit delayed. I think Chi's frozen, so we might come back to her. We have had a question come in about the links between climate change, environmental degradation, and long-term disability. This is from Stephen Hallett at the University of Leeds. Stephen asks what measures can be taken to mitigate these links. Tong, do you have an answer for that one on looking at long-term disability and health impacts of climate change?
Well, I think there's many ways we can do from the health sectors, but I think it's also very important for the environmental climate change side. that to take, for example, for the air pollution is relatively straightforward. That if we reduce the air pollution emission, then we should be able to reduce the exposure and also reduce the risk factors. And for the long term will be benefits. But the challenge is now, I think the carbon neutrality, the target the governments are setting, provide the opportunity for us to reduce the air pollution much faster, much dramatic. So actually the health benefit side from air pollution will be even much larger than we can expect, imagine expected. So I think if we coordinate the emission reduction of carbon, in the meantime, reduce the air pollution to achieve the most health benefits, that's what currently we should do from the research side, also from policy side.
Thank you, Tong. I wanted to ask Haidong if you have any examples of some positive initiatives happening in China, whether it's from a policy perspective or initiatives in the healthcare community that are aiming to address some of those impacts you talked about in your presentation.
Thanks for the question. I think at the national level, I have no knowledge. Actually, I don't know any policy at the national level to mitigate the health impact of climate. But at least in local level, for example, in Shanghai, the Shanghai government, municipal government, and has a plan in some district of Shanghai, Minhang District. They have a plan. They have a very, very useful intervention study to mitigate the health effects of climate. And they send message, a cell phone message to old people about to predict the health risk of heat wave and cold spell. And just in the last month, they evaluate the effectiveness of the program and find it's very, very useful. But I think at the national level, our government needs a very strong policy to mitigate the health effects of climate.
Yeah, absolutely. I want to ask each of you, given that we do have COP26 starting next week, and we have talked about the importance of collaboration, whether it's internationally or through different actors that are involved in the health impacts of climate change. What is your one big hope for something positive to come out of COP26? So I'll go around the screen. Yanis, can I start with you?
Yes, thank you. Thank you, Hannah. I think, personally, I think most of the people in this panel, actually, we're interested on climate change. And in relation for things like air pollution as well, because as well, there are things we can modify. We can modify the environment. In relation to mental health, you cannot modify, or in other parts of health, like your genetic makeup, or you cannot revert your childhood experiences. So in this sense, these factors are modifiable. So for me, having net zero emissions and fulfill the standards will provide, and agree that nationally will provide a good benchmark of actually moving forward, because this will mean that a lot of other modifiable risk factors will affect the populations globally as well, and improve our population health and mental health.
Thanks, Yanis. Tong, can I go to you next?
Yes, I really looking forward to the spirit of international collaboration. Not the point fingers to each other, but the international collaboration to take actions, not just simply empty promising. So that's why I'm looking forward for that.
Thank you, Tong. Haidong, what about you?
My message here is the disease burden of climate or weather is much higher. Actually, it's much higher than our previous estimate. So in the future policymakers, I think the consideration of health is very important.
Absolutely. And Ying, what about over in Australia, you've had the net zero announcement in the last couple of days, which is a positive sign, or what can you share on your hopes for next week?
Strong leadership is important. I would like to see more commitment policy changes to drive more climate actions, because we can achieve multiple benefits from climate change actions, and not only about health, but also economy and environment and the whole society. Yeah, thanks.
Well said, Ying, thank you. And Shuo, can we finish with your perspective on COP26?
I guess I would like to hope that the sense of emergency is much more resonant in this COP, because I think time is running out, and there's a sense, and that sense is being shared with the general public as well, in terms of what's been in the UK media, at least. So I would hope that that would feed into the commitment that are going to come out from COP26, and that actually the timescale in terms of the Paris Agreement and other timescales probably do need to be brought forward. So more commitments faster, please.
Definitely. Couldn't agree more. Well, I'm sorry that this is, a short discussion as we've come up to time, and there's so much we could have delved into, because each of your presentations raised so many fascinating issues, and we really appreciate you sharing your insights and your expertise with us today. I think this having this conversation is really an important part of addressing some of those issues that we've identified today, and contributing to the dialogue, and hoping to address the lack of awareness that may exist, or the lack of urgency that we might be seeing. So I really hope that that people have something to take away from this, and that they've learned something. I know we've had a lot of comments coming through on the chat asking if this will be made available as a recording, so they can go through the presentations again and pull out some of that detail. So it will be available, and we'll be sending the link to everybody next week. So keep an eye out for that. I wanted to say thank you so much to all of our speakers. It's been fantastic having you, Shuo, Yanis, Ying, Tong, Haidong, and Chi. Chi, I'm hoping is going to join us. I think her video just froze slightly at the end, but maybe we can bring her back to say, there she is. Chi, thank you so much for joining. And thank you to all our audience for being part of this event for China Week. Please do have a look at our website for the next event. We've got one shortly coming up on digital activism in China, and one later today on the Belt and Road Initiative. So everyone's welcome to come along, and thank you all so much, and hope to see you again soon.
Thank you.